Hello, everybody. How are y'all doing today? I'm Jax James, and I'm NORML State Policy Manager, and so I'm coming to you with the Friday update. You'll notice in the description of this video, there's some links to the update blog I created today. That's where you'll find all of the action alerts for these moving bits of legislation. And you'll also find links to become a member, donate. There's also our ACT page, which has federal actions, so some good resources for you there. I'm going to go ahead and start off with the legislative update for today. So first is going to be, I'm trying to not have my computer shake by using my keyboard, so hopefully this works okay for everybody. And while I'm going over all of this, if y'all want, please feel free to drop where you are in the comments. I see Mississippi. Mississippi, I have an update for you shortly. All right, starting with Wisconsin. So multiple bills have been introduced that would reduce possession charges in Wisconsin. Currently in Wisconsin, possession of any amount of marijuana is a misdemeanor that carries up to 6 months in jail and a $1,000 fine. So that's about as bad as Texas, which we are working on. If you didn't see our blog on that recently, make sure that you check that out. Also, Marijuana Moment had a great article about the governor's recent statements, and I was on Spectrum News last night about that. So I see quite a few Texas people chiming in. Welcome, y'all. All right, so in order to change the law in Wisconsin, there is Assembly Bill 812, which reduces the penalty of possession for 14 grams of marijuana or less to a $100 civil penalty. This bill also eliminates counting for the purpose of determining if a person is a repeat offender. A criminal offense of marijuana possession involving 28 grams or less is what they would be counting. This bill also reduces the civil fine to not more than $10 for drug paraphernalia. So that addresses both possession of the flower and paraphernalia. Now, Senate Bill 164 and Assembly Bill 130 both seek to reduce the penalty for possession of 10 grams of marijuana. This would be a $100 civil fine, no jail time, but it would increase the second penalty of up to 10 grams. So there's a little bit of give and take there, I guess. Senate Bill 790 reduces the penalty for 14 grams of marijuana to a $100 fine and eliminates jail time, but then also does escalate for 14 grams or more like the previous bills I mentioned. So again, if you click our blog today, you will be able to see the action alerts for these bills coming out of Wisconsin and also now West Virginia. I see people tuning in from some of the states I'm going to be covering, so I'll get to all of them shortly. So West Virginia, there's a lot of bills. So I'm going to try to make sure that I hit all of them effectively and correctly. So let's see if I can get West Virginia all straight. So HB 2534 would allow for medical cannabis patients to possess and combust cannabis flower. Current law only allows for vaporization. So that's one of NORML's core tenets. We do support that. Also, HB 2550 allows patients for home cultivation of up to 10 plants with a maximum of 5 mature plants for their use. And that is another tenet of or core value of a robust medical program in NORML's eyes. So we support that. You'll find the link there. Now, next, let's talk about, I actually printed it on paper to try to prevent my screen from bouncing. So we'll see if this is actually, this isn't going to probably last this way, y'all. So legislation has been filed actually about adult use. So in West Virginia right now, it is a misdemeanor of up to a $1,000 fine and 6 months in prison for any amount of possession. There is House Bill 2291 and Senate Bill 649 that seek to legalize personal use and possession of up to 1 ounce of cannabis by adults and also authorize localities to engage in retail sales. Also, HB 2912 is pending, and it seeks to legalize sales via retail outlets, and adults would be able to purchase 2 pounds of marijuana at a time and grow up to 3 plants for personal use. So that's in West Virginia. Again, you'll find a link for those action in our blog post today. Additionally, there is an employment discrimination bill. House Bill 2517 would remove marijuana from the screening requirements for West Virginia Alcohol and Drug-Free Workplace Act. There is also that was my own fault hitting this table that I'm on. There is also legislation where did I leave off? Sorry. Looks like something happened with my connection there. With penalty reduction, currently, it's a crime of a $1,000 fine and 6 months in jail in West Virginia for any amount. And the House Bill 2060 would reduce the penalties for personal possession of up to 15 grams of marijuana to a $500 fine and a maximum sentence of 72 hours in a detention facility. Also, SB 85 seeks to reduce the penalty for personal possession of up to 15 grams of marijuana to a fine of no more than $25. I think that $25 is a much more reasonable amount than 572 hours, but both bills arguably make it better than it already is in West Virginia. So again, a link to these legalization, medical expansion, decriminalization, and employment protection actions are all going to be in that first blog post link. Now, there is a bill in West Virginia that NORML is currently opposing. House Bill 3205 would scale back employment protections for registered medical cannabis patients. It would also prohibit employees from taking action against an employer for discrimination or wrongful discharge based on medical cannabis use. So we don't like that. There is a link if you would like to email your legislator in West Virginia to oppose that legislation. Now, in South Carolina, there is a update for SB 150. It's likely to be debated sometime next week. Now, SB 150 is the South Carolina Compassionate Care Act and allows qualifying patients to use, purchase, and possess medical cannabis with a physician's recommendation. So this bill has had some ups and downs, but it's coming to the Senate floor, and hopefully we'll have a robust debate and pass. So please make sure that you email your legislator to let them know that you do support this legislation in South Carolina. Next to Mississippi. So there's kind of a lot of context to this, and it is a 400-plus page bill that has been filed. So I do want to cover a few details that matter regarding this legislation in Mississippi. So on November 3rd of 2020, a majority of Mississippi voters decided in favor of a citizens initiative providing comprehensive patient access to medical cannabis. However, the Supreme Court nullified that vote and the ability for citizens to engage in these future initiatives, which is problematic. But in an effort to continue the conversation in Mississippi, the Mississippi Medical Cannabis Act, sponsored by Senator Kevin Blackwell, seeks to restore the voters' will by creating medical access for patients in Mississippi. It's attempting to create a middle ground between the very restrictive approach preferred by some legislators and by the governor with the voters' desire to have a robust program. So there is a link that you'll find there that takes you to a really great write-up that MPP did about this legislation. As I mentioned, it's 500 pages long, so there's quite a lot of details to it. There's some good, there's some not so good, and so definitely make sure you take a look at that. And then you can use our link to send a message to your legislator, letting them know what you think about this legislation. In general, it's going to be a positive for patients to be able to have access, so supporting, but maybe noting some changes that you would like to see to the program. All right, let's go to another southern state, Kentucky. So legislation has been filed to legalize the use, possession, and retail sales of marijuana for those that are adults in Kentucky, adults meaning 21 and up. Current state law, possession of up to 8 ounces of marijuana is considered a misdemeanor, punishable by up to 45 days in prison and a fine of $250. So still a crime in Kentucky, and this bill would put legalization on the ballot. If passed by voters, and the bill number, excuse me, is HB 225, if passed by voters, it would guarantee the right of an individual 21 and up to possess, buy, or sell 1 ounce or less of cannabis, and to also cultivate, harvest, and store up to 5 cannabis plants for personal use. So those are important. Make sure you take action if you live in Kentucky. Click that first link in our description of this video, and that will take you there. Now we're going to cover Indiana. Let me just, actually, I see there are a lot of comments. Let me see. Welcome, Mississippi and Texas, New Jersey, Indiana, Wyoming, Virginia. JM will be on with Virginia NORML later today. Justin says Texas is ruthless. You heard it. All right. Georgia, Florida. More Texas. Hi, Texas people. Someone from the UK. All right. North Carolina. Cool. I love seeing you guys from all over the place. Thank you for joining me today. I'll be here every Friday as long as legislative session's going on. All right, so now moving on to Indiana. There are 2 bills that have been filed to regulate an adult use market in Indiana. So SB 324 legalizes up to 1 ounce of cannabis for those that are 21 years of age and older, and it's just for a purchase. Then HB 1311 and SB 414 would legalize marijuana purchases of up to 4 ounces for those that are 21 years of age and older. There also is an option for delivery and an allowance for home grow cultivation of up to 4 plants. So those of you in Indiana can go to our blog today, scroll down to Indiana, and click a message to send some support for that legislation. I saw some people from Georgia tuning in. So currently, in Georgia, there is a limited CBD program there. And this legislation, House Bill 1117, would expand the pool of patients of those eligible to receive this therapy, CBD therapy, and it's for ulcerative colitis. So this is a very limited expansion, but for those with ulcerative colitis, it's extremely important. If you decide to send a message because you're in Virginia, I encourage you to request that they make the program more inclusive for the thousands of patients with debilitating conditions who live there. All right, moving on to Florida. There is some legislation to decriminalize small amounts of marijuana there. There is House Bill 957, which would reduce the penalty for possession of up to 20 grams, which is currently a $1,000 fine and up to a year in prison. No, to a non-criminal civil violation punishable by a $100 fine or community service. I do appreciate when there is always a diversionary way for people who maybe cannot afford the fine to be able to still fulfill their requirement. However, of course, we'd like to just see a regulated market there, but important moves. Another decriminalization bill is House Bill 1232, which would be for 2 ounces of marijuana or less. So those are the 2 bills currently moving in Florida, and you can click there. Now, there's also some retail bills that are going on in Florida, and statewide polling shows that 65% of Florida voters believe that cannabis should be legal for adults 21 and up to purchase. So, to that end, there's like 6 bills about it, and I'll go over these with y'all. House Bill 549 and House Bill 467 allow for the personal possession of up to 2.5 ounces of marijuana and for the home cultivation of 6 plants. Then House Bill 551 establishes regulations for business licensing. Senate Bill 776 allows adults to purchase up to 2.5 ounces at a time and possess up to 4 ounces. Additionally, the measure facilitates the expungement of past criminal records for cannabis-related offenses. So we do love to see expungements. That's one of our priorities here at NORML, is to make sure that those are moving. Then we have Senate Bill 1884, which allows adults to possess 2.5 ounces of marijuana and permits home cultivation of up to 6 plants. It also allows for centers, essentially consumption centers. There's a lot of different terms that they use for it, but that's what they would be doing. So if you live in Florida and you would like to support these myriad of options of legalization legislation, make sure you go to our blog today, scroll down to Florida, and click a link to send an email to your legislator. So I've got 2 more states to go on my update list, and then I see that there's some questions about Texas in there that I'll get to. But Delaware, HB 305 is a revised version of adult use legislation that has been introduced previously by House Representative, and I feel like I might just ruin this name, Ed Osiniski. I don't think I said that right. I apologize, Representative. But there were a lot of amendments offered last time, so many so that it forced the representative to pull the bill and address some of these issues. So now the new bill incorporates several of these bipartisan amendments, including provisions to provide for the establishment of a Justice Reinvestment Fund. If enacted, this fund would allocate resources back to the communities that have been over-enforced and disproportionately impacted by cannabis prohibition. And of course, equity. There's a lot of different types of equity that need to be addressed in the cannabis space. This is one, and so of course we support that. And then lastly, Alaska. HB 246 would seal the records of those with low-level crimes for 9 types of criminal background checks. People with otherwise clean records do not deserve to have the rest of their lives under the shadow of those charges. So this is extremely important legislation in Alaska to make sure that past records do not continue to haunt their citizens there. So I see Marcy is asking about Texas. So I will go over that with you. So in Texas, we have our legislative cycle every 2 years. So we've got a 2-year cycle. Currently, we're in the interim and primaries are coming up. And our next legislative cycle is going to be in January of 2023. However, during the primaries, just the other day, the governor restated his position to stop stockpiling jails with Texans for marijuana possession. However, he misstated what the penalties are in Texas and appeared to be under the impression that he had passed some legislation that he had not. Now, I can speak to the fact that there have been some bills to decriminalize and reduce penalties in Texas, and the governor's office did work with authors to try to get this legislation moving. They did go over to the Senate, and then the lieutenant governor stopped those bills from moving forward. So it's good to hear the governor double back down on his support for decriminalization. However, it's extremely important that we make sure that legislation gets through the next session, arguably something more robust than has even been offered before, because we have to wait every 2 years in Texas. So make sure you get out and vote in the primaries in Texas. I feel like, did Texas invent gerrymandering? We might have, because oftentimes you know the political party of the district you live in, and if you participate in that political party's primary, you can help influence to make sure that there is a more cannabis positive candidate on the ballot. That being said, there are some local measures I wanted to touch on. Jake put a blog out on the Austin measure. Essentially, in Texas, our law is a state level law, but the localities have discretion. So city council controls the purse strings, DAs and prosecutors control the type of charges they decide they want to bring and the policies for arrests that they'll do. And then there's also diversionary programs that can be created. So in Texas, we've seen a lot of diversionary first chance programs. We've seen DAs and prosecutors refusing to charge on personal level amounts of cannabis possession. And in Austin, there was a resolution to have a budgetary restriction where no police officer time or THC testing could be done on cannabis for personal amounts in Austin. And this ballot initiative, one of the aspects of it is to codify that. And so it will be on in May, and the same organization is working in Colina and San Marcos to do similar initiatives in those areas. So I just wanted to give some texture for what's going on in Texas. It can be kind of confusing because we have to change the statute at the state level, but there are, mitigating things that localities can do to try to stop the bleeding, if you will. So I'm going to real quick. So I see a few questions about states that I did not cover today. And so I want to make sure that you go to normal.org/act and check out our page there. That has not only federal actions, but it has actions for each state. So you can hover over your state and find out all of the different actions that are going on there. So if you do not see your information listed in the blog post, you can just go straight to normal.org/act and participate in all of the actions that you could ever imagine. Let's see, any other questions? So say, for like Tennessee and North Carolina, people asking about that, that's where you'll find your updates there. All right, guys. I hope you will also check out the blog I put out earlier this week, and I gave an update on ballot initiatives and referendums across the state, or I'm sorry, across the country, and where they're at in each of those states. Of course, things can change, and so I'll keep you guys updated as these things happen. But for now, I will sign off and say thank you so much for joining me today, and I hope that y'all have a wonderful weekend.